Hey everyone, welcome back to the channel. I hope you're doing well today. Grab a cup of coffee or tea, because this story is one of those big ones that really makes us stop and think about where the country is headed when it comes to health, science, and trust in our institutions. So, here's what's going on. The governors of Washington, Oregon, and California just announced that they're forming a brand new regional health alliance. Now, at first, that might sound like just another political move, but there's a deeper reason behind it. They're doing this because the Centers for Disease Control and Prevention, the CDC, is in turmoil right now. If you haven't heard, under the Trump administration, and with Health Secretary Robert F. Kennedy Jr. calling some of the shots, the CDC has gone through a wave of budget cuts, staffing shakeups, and even the rise of some anti-vaccine voices within the agency. And that has a lot of people worried. You can check out the full story over on AP News. Now, think about that for a second. If the agency that's supposed to be the gold standard for public health guidance starts losing credibility, who do people trust? That's exactly why these governors are stepping up. They say, look, we're going to make sure vaccine guidance in our states is rooted in real science, based on data from respected medical organizations, and not swayed by political winds. And honestly, it kind of makes sense. During the COVID-19 pandemic, these same states worked together before. Remember how they coordinated on reopening strategies and even pooled resources when federal guidance was confusing? Well, this is like a sequel to that. Of course, not everyone is happy about this. The Department of Health and Human Services fired back, accusing these governors of actually fueling distrust in the first place, saying their strict lockdowns during the pandemic pushed people away from public health institutions. And they're pointing to the Advisory Committee on Immunization Practices, or ACIP, as still being the official, science-based source of vaccine advice nationwide. But here's the thing. Recent events tell a different story. When CDC Director Susan Menares was fired after just a few weeks on the job and other top officials started leaving, it made people wonder, is science really at the center of these decisions anymore? There's more on that angle in another AP News report. Now, here's where it gets even more interesting. The West Coast isn't the only region doing this. In Illinois, the state's Immunization Advisory Committee is taking the lead on its own vaccine guidelines. New Mexico just gave pharmacists the green light to follow state-level advice instead of waiting on federal recommendations. And in the Northeast, states like Massachusetts, New York, New Jersey, and Pennsylvania are teaming up to make sure their vaccine guidance is consistent across the region. So, this isn't just a West Coast rebellion, it's kind of becoming a national trend. States are stepping up because they feel the CDC isn't the reliable voice it once was. You can dive into those details over on AP News. But that raises a big question for all of us. If states are all creating their own vaccine guidance, what happens to national unity on public health? Imagine if you're traveling between states and one tells you a certain vaccine is recommended, while another says it isn't necessary. Could that lead to confusion? Could it even put people at risk? What do you think? Are we better off with states taking charge? Or does it only make sense if we have one strong national authority? And speaking of filling gaps, it's not just states stepping up. Universities and hospitals are stepping in too. The Vaccine Integrity Project at the University of Minnesota is now putting out vaccine safety data, and Boston Children's Hospital brought back its vaccine locator tool to help families. Other groups are even trying to safeguard critical health data that the CDC used to handle. These are great efforts, but here's the problem. They don't have the same reach or authority the CDC once did. It's kind of like having local neighborhood patrols when what you really need is a full police department. Helpful, yes. But is it enough to replace what's being lost? That's the big debate. More about those efforts is also covered in this AP News piece. So, here's where I'll leave it. The West Coast Health Alliance could be a blueprint for the future, a way for regions to say, we're not going to wait for Washington to figure this out. But at the same time, if the CDC can't rebuild its credibility and authority, the U.S. might end up with a fractured public health system, and that's not exactly ideal when you're fighting things like pandemics. What do you think? Do you trust states more than the federal government when it comes to health decisions? Or does this patchwork approach only add to the chaos? Drop your thoughts in the comments, because this is one of those moments where public opinion really matters. And as always, Thank you so much for watching. If you found this video helpful, please hit that like button, share it with a friend, and subscribe for more stories just like this one. Until next time, stay informed, stay safe, and I'll catch you in the next video.